This video will review the Integumentary Command Center for Start a Care visit. You can access the Integumentary Command Center through Visit Actions, through Physical Assessment, or if you scroll down, the Integumentary Command Center.
Alright, so before we look at the Integumentary Command Center, there are two things we need to complete first. We've already completed our pathways, and we've already completed the plan of care development. One thing to note with the plan of care development is that we have set the contained wound care orders to yes flag here. So now that those two items are done, it allows us to proceed to the Integumentary Command Center.
Let's tap here. So the first section here is features. You have the integumentary assessment, and this is the link to the existing integumentary assessment available within physical assessment. Interventions and goals from problem statements related to wound care will continue to be addressed within interventions and goals. So these are just links to the interventions and goals sections of visit actions. We're going to scroll down to Reference PRN. So Reference PRN has a medical records link and also a link to the infection control form. And then if we scroll down and tap Other, we have links to supplier requisitions and supplies delivered to order anything you need for wound care. Alright, so let's scroll back up to Wound Record. We're going to talk about documenting the wound. And so document here, this is a starting point for all wound documentation. You are required to address wounds at start of care, like we're doing now, resumption of care, recertification, and subsequent visits whenever there is an active wound owned by the same discipline. Alright, so let's tap on Document, and then you get a confirmation, are there wounds? If there aren't any wounds, you'll just tap No Wounds. If there is a wound to document, you tap Wounds Present. So then we can add a new wound down here on the right, Add New. And what opens up is a full body image that defaults to the gender in the referral. So since there are over 650 possible wound locations, we want to be precise as possible with where the wound is. If we tap this drop down, you can get to different parts of the body, so the anterior, posterior, or the right side, left side, the foot. And then also, if needed, you can flip to a female view. Okay, so we're going to do the male. Keep it on the male end here. And let's say we have a wound on the chest. To be accurate, we're going to tap on the chest to zoom in, and then we can tap again on the chest to select the location. So this just helps us be very accurate with where the wound is located. So we'll select here upper outer quadrant. Okay, so the next step here would be to select our wound type. So we're going to tap down and we're going to select, scroll down, surgical wound. And then if you need some reference information to show wound type reference, okay, then we can select wound location descriptors. This is an optional field, but allows for more specific description if needed. So let's tap on that and we'll say that it's anterior and it's left and select. Okay, and then it's required to select the wound onset date. And you want to follow agency policies for selecting this date. We'll say Tuesday. From here we can tap Save. And now we've established the wound in the wound record summary screen. So you'll see we have our anatomical view with an X where our wound is located. You'll notice that we have a wound number now, so this is wound number 1. The wound number will never change and begins at 1 and is incremented for each additional wound added. The red text indicates that the wound has been established, but documentation has not been complete. As you see, we haven't documented anything about this wound. And then we can also tap Details to get our zoomed in view of the wound, or we can tap Summary to come back out. We're going to add a second wound, so tap Add New. And drop down, we'll flip to the male posterior, and we'll add a second wound on the buttocks area. So remember, you tap to zoom in, and then you can tap again to select the location, because you want to be as detailed as possible with the location. Okay, select the wound type, and we'll select a pressure ulcer stage 2. Again, select wound descriptors as optional. We'll say posterior, and select wound onset date is required. And then tap Save. And now you'll see we have wound number 2. So now if we tap Details, it's going to show wound number 1 on the anterior, and then this drop down, we select posterior, and then here's our details for wound number 2. Tap on out, back out to Summary, and it's set on the posterior view, so it's showing us the back. If you want to see the first wound, we tap anterior and flip back around. So now we're going to document wound number 1. So we're going to tap on this hyperlinked text here that's red to open up document. So we're going to start with orders. Each wound must be associated with an order. The start of care visit shows the locator 21 text, so we'll tap on order.
So what we need to do is select the appropriate locator 21 order to associate and create a wound care provided template. So what we can do is we can scroll through our orders here that we selected in the plan of care development and find the order that relates to this wound for our wound care provided template. So like this one, and it's this one that we want to use because this details a wound care that should be provided. So we're going to copy this text into the edit wound care provided template, and then what we want to do is make it past tense by editing the template to remove unnecessary verbiage. So we could change this to skilled teaching provided. Okay, and then we irrigated the site with normal saline. We applied Altophone, AG. We covered with AV pad, and we secured with tape. Change every 4 hours. Okay, so the purpose of creating this template is to ensure the wound care documented matches the order. Since this is the wound care we provided, we want to document that in the order. And now we also have a template that will be used to document wound care provided in subsequent visits. So we can save that, and now we are done with our orders.
So now we'll move on to assessment. This option exists to document wound assessment or state not assessed. So tap on assessment and we can either document or not assess. If we select not assess, we'll have to select a reason why the wound was not assessed. So here's some reasons. We're going to back up here and tap on assess again, and we are going to document. And you'll notice that the assessment questions are similar to current forms. So you're just going to proceed through and answer these questions to generate your Watt score. Okay, so I'm just going to walk through and just going to answer these questions. And if it's required in the text box, it's required to be answered. Okay, once you've completed answering the questions, you'll get your Watt score, and you can tap dismiss, and now you have a check next to assessment. So once you've completed your assessment, you get your Watt score, and one thing to keep in mind, a 4-point deviation from one visit to the next in the Watt score will generate wound score deviation workflow in the office.
Okay, once we have documented on our wound, then we can come to wound care provided, and we can select care not provided. If we select care not provided, we have to give a reason why we didn't provide wound care. We're going to tap here and tap on document because we did provide wound care. And here's our template of the wound care provided, and we can add additional text down here at the bottom, so we'll add tolerated well. Okay, and save. And so now we've provided our wound care.
We can move on to wound actions. You can see that we have a delete option here. A wound can only be deleted in the visit in which it was created. So subsequent visits for this patient, they will not be able to delete this wound since it was created in the start of care. And reports, so we can look at reports, the wound record report. We tap on this report, and what this report gives us is the baseline. And the baseline is the first assessment of the wound. And this baseline will always stay with this wound. As subsequent visits evaluate the wound, this report will populate with 5 visits worth of wound information. Let's back out. Return now to our wound record summary screen. So we can tap back. And what you'll notice that since we've completed documenting on wound number 1, the link in the text here is now blue. Since we have not documented on wound number 2, it is still red. So now we're done documenting wound number 1, we're going to come out of the screen. What you'll notice is we get a validation warning that wound documentation is not complete. Are you sure you want to exit? And this validation exists to ensure ICC is completed prior to being able to complete the visit note. So you can cancel, come and document, or you can exit out if you're going to come and document a little bit later. So we'll tap exit. Right, and one last thing to look at, we're going to come back out of visit actions, and we're going to come to the PRN section. So tap on PRN, and you'll see that wounds is no longer available here because it is now incorporated within the ICC. And that completes this overview of the Integumentary Command Center and the Start of Care visit.